Test, test. block, and all of which are discussed at the subcommittee's legislative hearing on June 21st. I will be supporting each of these bills on today's agenda as they are common sense measures that should garner bipartisan support. In accordance with the committee rules, the subcommittee has contacted the Congressional Budget Office seeking informal preliminary cost estimates for each of the bills being considered this afternoon. Many of these preliminary scores are represented by a range of potential costs, along with an estimation as to whether those costs are mandatory or discretionary. As is our normal practice, we will need to get official scores and identify necessary offsets before any of these bills go to the floor. I look forward to working with the ranking member and other members of the subcommittee to find any necessary offsets that would have the least impact on our veterans. I also want to note that there are still multiple opportunities to improve and make necessary changes to any of these bills. The ranking member and I will continue to work with our colleagues on the subcommittee and any stakeholders who have feedback as we continue to work through the legislative process. I now recognize the distinguished ranking member for any opening comments she may have.
Thank you, Madam Chair, for organizing today's markup. I will keep my comments short so we can proceed to today's events quickly. Several of the bills on today's agenda represent important bipartisan efforts to address urgent needs in the veteran community. This includes my bill, H.R. 1278, the DRIVE Act. This legislation would increase the mileage reimbursement rate for VHA's beneficiary travel program. Congress originally set the reimbursement rate in 2010 at a minimum of 41 cents per mile, which was comparable to the rate federal employees were reimbursed for work-related travel at the time. Since the enactment of this law, VA's reimbursement rate has remained stagnant, even while gas prices and other costs like auto insurance and vehicle maintenance costs have increased significantly. Meanwhile, the GSA rate has risen to 6.25 cents per mile for federal employees using privately owned vehicles. My legislation will authorize VA to make the reimbursement rate for VA beneficiary travel equal to or greater than the GSA mileage reimbursement rate for government employees using private vehicles when no government vehicle is available. This will help eliminate financial barriers that may be keeping veterans from receiving the care and services they have earned and deserve. I urge all of you to support the bill, which is included in the en bloc. Thank you, Madam Chair. And thank you, and I yield back.
Thank you, Ranking Member Brownlee. I now call up H.R. 3520. The clerk shall report.
H.R. 3520, to improve the provision of care and services under the Veterans Community Care
The bill was
Program.
circulated in advance pursuant to committee rules without objection. The first reading is dispensed with. The bill is now open for any amendment at any point, and I have an amendment in the nature of the substitute at the desk. The clerk shall report.
Amendment in the nature of a substitute to H.R. 3520, offered by Mrs. Miller Meeks of Iowa. Strike
I ask
all-
unanimous consent that further reading of my amendment in the nature of a substitute be dispensed with. Hearing no objection, so ordered. This amendment will be considered base tax. I now recognize myself for 5 minutes to speak in support of my amendment in the nature of a substitute to H.R. 3520. This common sense legislation would continue to make the VA healthcare system more accessible to veterans by setting an expectation of timeliness of care. Additionally, this bill would require the VA to be transparent with veterans when they are deciding the best options for their care, whether it is in the VA, telehealth, or in the community. Veterans are able to receive quality and more timely care when VA partners effectively with community care. Veterans should have full transparency into their eligibility, their options for care, reasons for denial, and avenues for appeals. My amendment would adjust the community care eligibility for residential substance use disorder treatment to a 60-minute average drive time. Further, this amendment would clarify that telehealth appointments can only be used to satisfy the meeting of access criteria when specifically available and agreed to by the veteran. My amendment also makes some technical changes requested by the VA where the language may have been unclear as to our intent. Again, other than defining a time and distance access standard for residential substance abuse treatment that was identified in our hearing earlier this year as desperately needed, this ANS does not expand any standard for community care that does not currently exist. I encourage all members to support this ANS, and I yield back the balance of my time. Do any other members wish to comment on the amendment in the nature of a substitute to H.R. 3520?
Madam Chair, I seek recognition.
The chair recognizes Ranking Member Brownlee.
Thank you, Chairwoman Miller Meeks. Unfortunately, I cannot support the ANS to H.R. 3520. I do really appreciate that you have addressed one of the main concerns we raised about this bill at our legislative hearing last month. Specifically, your amendment eliminates a provision that would have allowed veterans to obtain community care referrals simply by expressing to their VA provider that it is their preference to be referred to the community for care. However, I'm still concerned that the legislation seems intent on suppressing veterans' utilization of VA telehealth when clinically appropriate. In the ANS, as in the underlying bill, VA would be prohibited from factoring the availability of VA telehealth appointments into community care eligibility determinations, even when clinically appropriate. While the legislation does specify that veterans may opt for VA telehealth if they would otherwise be eligible for community care, it does not require VA to proactively inform veterans when VA telehealth appointments are an option. Meanwhile, Section 5 of the ANS would require VA to proactively inform veterans if they can obtain community care via telehealth. This just doesn't seem right. Why would we want to bar VA from presenting to veterans the full picture about the availability of telehealth, both within VA and from a community provider, at the time they are choosing where to receive care? The ANS also changes from 30 minutes to 60 minutes the drive time standard that would make veterans eligible for referral to community providers of residential substance use disorder treatment. Before agreeing to this geographic access standard, I think the committee needs more information about the potential costs. I understand that we have a preliminary score from CBO, but it does not include detail on this provision specifically. I'd also like to obtain views from the VA about whether another threshold, perhaps 90 minutes, would be more appropriate. For these reasons, I cannot support ANS to HR 3520, and I urge my colleagues to join me in opposing it.
Thank you, Ranking Member Brownlee. Do any other members wish to comment on the amendment in the nature of a substitute to HR 3520? Seeing none and hearing none, and since no other amendments were filed, the question now occurs on my amendment in the nature of a substitute to HR 3520. All those in favor say aye. Aye. All those opposed say no.
No.
In the opinion of the chair, the ayes have it, and the amendment in the nature of a substitute as amended is agreed to. I now recognize Representative Bergman for a motion.
Madam Chairwoman, I move that the Health Subcommittee report H.R. 3520 as amended favorably to the full House Committee on Veterans Affairs.
There is a motion to favorably forward H.R. 3520 as amended. All those in favor say aye. Aye. All those opposed say no. In the opinion of the chair, the ayes have it, and H.R. 3520 as amended is favorably forwarded to the full committee. I now call up H.R. 1850. The clerk shall report.
H.R. 1815, to require the Secretary of
The
Veterans
bill was
Affairs.
circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with. The bill is now open for any amendment at any point. Who seeks recognition for the purposes of offering an amendment?
I have an amendment in the nature of a substitute at the desk.
The clerk shall report.
Amendment in the nature of a substitute to H.R. 1815.
I ask unanimous consent that further reading of the amendment in the nature of the substitute be dispensed with. Hearing no objection, so ordered. This amendment will be considered base tax. I now recognize Ranking Member Brownlee for 5 minutes to speak in support of her amendment in the nature of a substitute to H.R. 1815.
Thank you, Madam Chairwoman. A 2021 report by VA concluded that the number of veterans eligible for nursing home care is expected to rise by approximately 535% over the next 20 years. Many of these veterans do not require the comprehensive care a nursing home provides and would be better served in an assisted living setting, yet VA does not currently cover this setting of care. The pilot established by H.R. 1815 could change that. During the legislative hearing in June, VA raised several minor issues in its testimony on the underlying text. Staff have incorporated these technical edits into this amendment in the nature of a substitute. I hope everyone will join me in supporting this sensible amendment and important legislation.
I thank the Ranking Member for her amendment in the nature of a substitute, and it has my support. Do any other members wish to comment on the amendment in the nature of a substitute to H.R. 1815? Hearing none, and since no other amendments were filed, the question now occurs on the amendment in the nature of a substitute to H.R. 1815. All those in favor say aye. Aye. All those opposed say no. In the opinion of the chair, the ayes have it, and the amendment in the nature of a substitute as amended is agreed to. I now recognize Ranking Member Brownlee for a motion.
I move that H.R. 1815, as amended, be reported favorably to the full committee.
All those in favor say aye. Aye. All those opposed say no. In the opinion of the chair, the ayes have it, and H.R. 1815, as amended, is favorably forwarded to the full committee. I now call up H.R. 1774. The clerk shall report.
H.R. 1774, to amend Title 38
The
United
bill was circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with. The bill is now open for an amendment at any point. Who seeks recognition for the purposes of offering an amendment?
Murphy.
The chair now recognizes the clerk shall now report.
I have an amendment in the nature of substitute at the desk.
Clerk shall report.
Amendment in the nature of substitute to H.R. 1774.
I ask unanimous consent that further reading of the amendment in the nature of a substitute be dispensed with. Hearing no objection, so ordered. This amendment will be considered base text. I now recognize Dr. Murphy for 5 minutes to speak in support of his amendment in the nature of a substitute to H.R. 1774.
Thank you, Chairwoman Miller Meeks. I'm pleased to offer this amendment in the nature of a substitute, and actually I'd like to thank Representative Alford for introducing 1774. The bill would ensure that eligible veterans who are reimbursed, make sure that eligible veterans are reimbursed for emergency transportation, whether it is the initial emergency or whether further follow-up care is needed. No veteran should have to worry about transportation costs when faced with a medical emergency. My amendment makes technical corrections requested by the VA and further clarifies that a veteran will be reimbursed for any emergency transportation either to a VA or non-VA facility. I would encourage all members support this amendment in the nature of substitute. I would yield back the balance of my time.
I thank Dr. Murphy for his amendment in the nature of a substitute, and it has my support. Do any other members wish to comment on the amendment in the nature of a substitute to H.R. 1774? The chair now recognizes Representative Van Orden.
I just want to say quickly that I've heard more comments about this particular issue from my constituents across the district because we're such a rural area, and I'm standing in very strong support of this amendment. Thank you for doing it.
Thank you. The question now occurs on the amendment in nature of a substitute to H.R. 1774. All those in favor say aye. Aye. All those opposed say no. In the opinion of the chair, the ayes have it, and H.R. 1774 is favorably forwarded to the full committee. I now call up H.R. 2818. The clerk shall report.
H.R. 2818, to amend
The
Title
bill was
30.
circulated in advance. The chair now recognizes Ranking Member Brownlee to make a motion.
Madam Chairwoman, I move that H.R. 1774, as amended, be reported favorably to the full committee.
Thank you. H.R. 1774 is favorably forwarded to the full committee. I now call up H.R. 2818. The clerk shall report.
H.R. 2818, to amend Title 38 United States Code to increase the amount.
The bill was circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with. The bill is now open for an amendment at any point, and I have an amendment, and there is an amendment in the nature of a substitute at the desk. The clerk shall report.
Amendment in the nature of a substitute to H.R. 2818.
I ask unanimous consent that further reading of the amendment in the nature of a substitute be dispensed with. Hearing no objection, so ordered. This amendment shall be considered base text. I now recognize myself for 5 minutes to speak in support of my amendment in the nature of a substitute to H.R. 2818. First, I would like to thank Representative Bacon for introducing H.R. 2818. This bill would increase the maximum amounts allowed for home improvements and structural alterations grant program. This grant program allows veterans to live more comfortably and with better access in their homes by providing medically necessary home improvements and other structural changes. Per VA's requested technical assistance, my amendment would increase the amount to $9,000 for veterans with both service and non-service connected disabilities. Additionally, this amendment would limit the number of renovations to 3 over the course of a veteran's lifetime and changes the annual inflation adjustment to the Residential Home Construction Index. It's important for veterans to be able to move within their homes with ease and access, which is why I encourage all members to support this ANS. I yield back the balance of my time. Do any other members wish to comment on the amendment in the nature of a substitute to H.R. 2818? Hearing none, and since no other amendments were filed, the question now occurs on my amendment in the nature of a substitute to H.R. 2818. All those in favor say aye. 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 All those opposed say no. In the opinion of the chair, the ayes have it, and the amendment in the nature of a substitute as amended is agreed to. I now recognize Ranking Member Brownlee for a motion.
Madam Chairwoman, I move that H.R. 2818 as amended be reported favorably to the full committee.
There is a motion to favorably forward H.R. 2818 as amended. All those in favor say aye. Aye. All those opposed say no. In the opinion of the chair, the ayes have it, and H.R. 2818 as amended is favorably forwarded to the committee. I now ask unanimous consent to consider the following bills en bloc: H.R. 1278, H.R. 1639, H.R. 2683, H.R. 2768, and H.R. 3581. Hearing no objection, so ordered. The clerk shall report.
H.R. 1278, to amend Title 38 United States Code to improve the
The
rate.
bills were circulated in advance pursuant to committee rules. I ask that the reading of the bills be dispensed with. Hearing no objections, so ordered. Does any member wish to speak on any of the remaining bills on the agenda? The chair now recognizes Representative Van Orden to speak on the bills.
Thank you, Madam Chairman. I'd like to speak about H.R. 1639. There's an Office of Mental Health and Suicide Prevention that is pre-existing at the Veterans Administration. It's been in business for about 40 years. What this bill does is it awards a sole source contract to the Education Development Center to do the job that the Office of Mental Health and Suicide Prevention of the Veterans Administration was created to do. The metrics that are assigned to this in this bill to this company are more than partially gathered by the Office of Mental Health and Suicide Prevention at the Veterans Administration, and this is a redundant program. I'm deeply concerned about this. I have to tell you, this is literally the scenario from the movie Elf, where the two writers could not write a book, so they hired a writer to write the book that they were being paid to write. And if you can't do your job, and you have to hire someone to do your job, you should be fired. And nothing will change at the Veterans Administration unless we start holding the individuals at the Veterans Administration accountable. So I'm deeply concerned about this particular amendment. The rest of the amendments to this en bloc are absolutely outstanding.
Do you yield?
I yield back.
Thank you, Representative Van Orden. The chair now recognizes Representative Kiggins for 5 minutes.
Thank you, Chairwoman. I just want to take this opportunity to speak to my bill, which was H.R. 3581, the Caregiver Outreach and Program Enhancement, or COPE Act. In Southeast Virginia and across the country, caregivers play a critical role in the lives of our veterans. As a geriatric nurse practitioner, I know that however rewarding it may be to provide care for one's loved ones when they need it most, it can also take an extremely emotional toll on the caregiver. That's why I introduced the COPE Act. It enhances mental health resources for veteran caregivers. By ensuring these men and women can properly take care of themselves, we in turn enable them to show up for their loved ones every day, improving the lives of our nation's heroes and solidifying the support system they need for healthy aging. This bill also requires the VA to reach out to eligible veteran caregivers and make them aware of the benefits available to them. Too often, Congress creates new programs without adequately notifying those that they are intended to help. Provisions in the COPE Act ensure that caregivers have all the tools they need to take advantage of these programs. I'm also proud to work with fellow veteran members of Congress to move this bipartisan bill closer to the finish line. In addition to my work on this COPE Act, I'm happy to be a co-sponsor of several of my colleagues' bills being considered today, and I wanted to take a moment just to express my support to the panel for H.R. 3520, the Veteran Care Improvement Act, which takes a dramatic step towards protecting access to community care. Despite legislative requirements to do so, the VA has been slow to expand access to community care options. Many VA facilities suffer from long waiting times and overwhelm providers, especially when it comes to mental health treatments. This bill seeks to remedy that by codifying access standards that allow veterans to get around long waiting times and get the care they deserve when the VA falls short. Thank you to the chairwoman for leading this effort. I'm also proud to co-sponsor H.R. 1815, the Expanding Veterans Options for Long-Term Care Act, led by Representative Slotkin of Michigan. This bill creates a pilot program expanding access to assisted living services for eligible veterans. There's a significant gap between the demand for elder care services and the ability of our institutions to provide them. Studies show most seniors would rather receive care in their own home rather than at a care facility. This pilot program will allow VA to begin to solve this growing issue among our veterans. Thank you to this committee for focusing on these issues affecting the health of our veterans, their caregivers, and our greatest generation. And I yield back.
Thank you, Representative Kiggins. Does any other member wish to speak on HR 1278, HR 1639, HR 2683, HR 2768, or HR 3581? Hearing none, and since no amendments were filed, the question now occurs on the remaining agenda items. All those in favor say aye. Aye. All those opposed say no. In the opinion of the chairs, the ayes have it. I now recognize Ranking Member Brownlee for a motion.
Madam Chairwoman, I move that H.R. 1278, H.R. 1639, H.R. 2683, H.R. 2768, and H.R. 3581 be reported favorably to the full committee.
There is a motion to favorably forward the remaining agenda items. All those in favor say aye. Aye. All those opposed say no. In the opinion of the chair, the ayes have it, and the remaining agenda items are favorably reported to the full committee. Summarizing today's votes, the subcommittee has voted to favorably forward H.R. 3520 as amended, H.R. 1815 as amended, H.R. 1774 as amended, H.R. 2818 as amended, H.R. 1278, H.R. 1639, H.R. 2683, H.R. 2768, and H.R. 3581 to the full committee. I ask unanimous consent that the committee staff be authorized to make technical, clerical, and conforming changes to the bills favorably forwarded today. Hearing no objections, so ordered. I want to thank the members for their attendance today. I want to thank the staff for all of their work, and this subcommittee is adjourned.
That's the fastest committee hearing I've had in a